Hey everyone, it is Dr. Jindai Stafford here, and I am not going to be before you long. I just wanted to jump on here and share with you guys today a little bit about skin mapping. So, skin mapping is a practice that Eastern medicine uses to help identify what could be going on inside the body. So, your skin is the largest organ that you have, and when you're doing skin mapping, they're looking at the face. Okay, your skin is the voice box, if you will, for your internal organs, right? So we could have things going on with our liver, our gallbladder, our heart, our lungs, and our intestines, and we don't know, right? We may not feel it, we may not recognize that there's something different going on inside of there. And so therefore, in order to get our attention without like half taking us out of here, your organs communicate with the larger organ, right? So they're like, hey, like I got this thing going on. So you might start to see blemishes or rashing on your face. Now, not all pimples are from um, hormones or genetic or anything like that. A blemish on your face can be a sign of an imbalance, whether it is related to nutrition, hormones, genetics, environmental factors, stress, right? The skin can be an excellent place, excellent source to be able to tell you what's going on inside of your body without, scheduling a doctor's appointment. Now, I will say definitely go and, talk to your primary care provider and make sure that everything's going good. They have the access to get testing done, and that's what they're there for, to help you out. But any good indicators that you're starting to notice any patterns on, and you're starting to realize like, hey, I haven't been feeling good in this area. Let's look at your face. Start with your skin mapping if you want to do it. Do an initial assessment yourself. But again, always talk to your primary care provider before implementing any new practices or anything like that. So the forehead area. So it's like right in here, your forehead area, right? This is the window to the liver and the gallbladder. Okay. And this will tell you if you have excessive fat consumption, right? Or too much alcohol may cause a lot of breakouts in this area. So to balance the system, you can minimize foods that are like super rich, minimize your alcohol intake, minimize your super fatty foods. You want to make sure that you're getting a lot of water, drinking plenty of water and fresh herbal teas. And some of the things that can help with the breakouts in this area are milk thistle and burdock root. These are often used to help support the liver and gallbladder health. Okay, so the next area is here between, right in here between the eyebrows. This is also known as your third eye. And this area is the connection with your stomach and your liver. Okay, so if you're getting breakouts in this area, then that's an indication of poor digestion, toxic buildup, and um, just heavy toxicity in the body could lead to blemishes in this particular area here. So you can try doing an elimination diet route. Again, talk to your primary care physician before you start like eliminating everything. But some of the things that will help is to reduce your caffeine intake, reduce your alcohol intake, and then reduce sugar intake. So the next area is going to be like your temple brow line here, right in these areas. Okay. These correlate to the kidney and could indicate dehydration and or overworked kidneys. Okay, so again, that's like these little areas here, right, in your temple brow line. So if you're having breakouts in this area, then it could indicate issues with the kidney. It could indicate dehydration or overworked kidney. So, and what you want to do in this case is you want to try drinking more water, right? Just stay hydrated. Drink more water and include superfoods into your diet. You want to do the dark berries, leafy greens such as kale and spinach, and then try introducing a type of algae or spirulina into your diet as well. If you're having breakouts under the eye here and across the bridge of the nose, okay, so under the eye and across the bridge of the nose, this could indicate that you're having issues with the stomach, kidneys, and liver. Okay, so the bridge and under the eye, stomach, kidneys, and liver. Okay, you want to again try reducing alcohol, caffeine, sugar from your diet. You also want to make sure you're drinking plenty of water, which also helps to detoxify the body. And you want to make sure you're getting a good quality sleep, right? Bags under the eyes, that can, that's obviously not good quality sleep. And that's going to start upsetting the balance of things, such as digestion, which is your stomach, and then your kidneys and your liver. When you do hydrate, as well. Like you want to get good quality sleep, but when you're hydrating as well, try starting your morning off with room temp water and then add either a half a lemon or half a lime into your water. That is excellent because the liver is very porous. The citrus fruits will help to cleanse that. And so when you're getting your good quality sleep, your body, your lymphatic system is actually going to work. It's like your sewage system for your body, and it's, helping to move and flush out these toxins. Well, if you start your morning off, first thing, don't go get coffee or tea first thing in the morning. Don't go get your Starbucks first thing in the morning. Drink a cup of room temperature water with either half a lemon or half a lime, or if you're using those squeeze bottles, squeeze lime, one squeeze of lemon, whichever you choose. I prefer lime water. My husband likes the lemon water. Either one works fine, and that will help to flush out the liver, flush out the kidneys, flush out all that bad stuff that your body's been so hard at work. Pulling from your blood and everything while you slept. Okay. So, good quality sleep and hydration. Again, remove the caffeine, alcohol, and excessive sugar out the diet. So, again, the bridge of the nose and the upper areas of the cheek. So, not under the eye necessarily, but the upper area of the cheek here. Okay. This is connected to the heart. So, you see, rosacea. Okay, rosacea appears in this area. So you want to make sure that you are including healthy fats into your diet. That would be like your omega fatty acids. I was trying to see if I had. Um, you can get your omega 3s, eating fatty fish. You want to make sure it's definitely wild caught fish because sometimes they have these fish now that they're starting to um, have tolerate corn and cornmeal for their diets. You want to make sure that you're getting wild caught fish, salmon. That's a really good fatty fish. And then you might want to start, taking a omega. This one is the one that I use and it's excellent. So that can help. And then you want to opt for like raw nuts, avocados, salmon, flaxseed, chia seeds. Those things are great in the healthy omega fatty acids as well. Okay. So the mid region of the cheeks, so right in here, that is the window to the stomach and lungs. It is notorious for rosacea breakouts as well. And then people will get hyperpigmentation in this area. So if you're experiencing any of that, breakouts, rosacea, hyperpigmentation, you want to try alkalizing your body. You can do that by eating plenty of dark green leafy vegetables and reduce the intake of acid forming foods and beverages. That would be your alcohol, caffeine, and sugar. Okay. So the nose, okay, the nose and the lower cheek area, it's going to be in here, right? Where the apple is, if you get the apple. So this is liver and stomach as well. This area is prone to wrinkles and breakouts, and it's usually blamed on food intolerances and toxic buildup. Okay. So if you are having breakouts or discoloration or any issues in the lower cheek and nose area, then you might want to try doing some um, eating some cleansing foods. So start adding in vegetables like vegetable juice, so celery juice, I know is a really big one. Experiment with different, vegetables that are cleansing that can help your body again detox. Again, we want to stay hydrated and we want to do lemon or lime water first thing in the morning, and that'll help. Okay, the mouth region, so up in here and around here. Okay, this is connected to the stomach. Okay, And so in this, you want to also consider food sensitivities or toxic buildup. So I know one of my kids, when they would drink the naked juice, they would get a rash right here, like drinking from the bottle. I mean, they weren't doing like the kid thing where, they have their whole mouth on it, but they were drinking it like this, you know, the top lip in the drink. And they would drink this particular naked juice and they would end up with a rash across here and all around their mouth. Okay. That is a stomach issue. So she was having a sensitivity to the beverage, right? There was a detox, there was a toxicity to of the beverage to her body. And so we had to obviously take her off of that. And then we would make sure that we gave her a lot of good green vegetables, and good fiber, apples, things like that to her diet. And then, of course, we would put on a homemade topical solution to help her with the rashing. But if you find yourself with any kind of breakouts over the lips or anything, make sure you add more green vegetables to your diet and more fiber to your meal. So you want to get those good fibrous fruits and vegetables in your diet. And then lastly, we have the jawline. Okay. This is infamous, especially for women, right in here, the jawline. This is an indication of ovaries and or the colon. And breakouts here can be triggered by hormonal stress, right? Especially again in women when we find ourselves getting close to our in the menstrual cycle, when we get close to actually, experiencing the menses, then we can get the breakouts here, right? Those hormones are fluctuating. Sometimes you might get the pre-cycle breakouts, or you might get like during your cycle, you're getting the breakouts, or like post then you're getting the breakouts. But while menstruating, women should include a lot of greens into their diet. Make sure that they're hydrating. You want to do hydrating foods as well. So your berries in the summertime, you want to do melons. Those are super hydrating. You can do tomatoes. Be careful because tomatoes are nightshades. So if you have sensitivity to nightshades, like if you have an autoimmune disease, then you want to, limit your intake of nightshades. But you could do cucumbers as well. Like, so you want to do not just, hydrating with water, but you also want to do hydrating fruits and vegetables as well. During that time of the month, obviously, we're losing blood, and blood is water. So you want to make sure that you're hydrating. And then you also want to try a balanced low glycemic diet of lean protein, fruits and vegetables, of course, whole grains, and healthy fats. Keep your stress levels under control, right? Woosah, easier said than done because, some individuals suffer from PMS. And so it's a little difficult to keep those moods under control. And then you want to ensure that you're getting good quality sleep because your body is doing a lot, it's going through a lot, and that sleep is going to be very helpful to your body's, natural process of doing what it does. And you want to make sure it's quality sleep because that's when you're really going to, get the good signs of waking up feeling refreshed and feeling good to go. Okay, and then that is all I have for you guys today. Hopefully, you learned something about the skin mapping. I always thought that that was really fascinating, and I know I use it for myself and my family, but I never thought to share it before, I guess. So there it is. I hope you guys found something, learned something new, and go ahead and make sure you like this video. Make sure you subscribe to the channel. If you have any questions, comment it below. Like, have you ever heard of skin mapping? I would really like to know. And then just share your experiences with skin mapping if you've, done it or not. And so I will see you guys in the next video. Take care.